Hi, it's Rebecca from Dystonia and me again. Today I was planning, as I said yesterday, on talking about the different therapies that are on offer for sufferers of dystonia. However, after certain conversations that I've had with doctors over the past week and a bit, I've changed my mind and decided to talk about the prejudices that sufferers of dystonia often experience when they have dystonia, especially if they've had certain experiences during their life. And when I say that, I'm specifically referring to abuse, and whether that's emotional, sexual or physical, doesn't really matter. As much as they're all very, very different, they're all hideous, and you should never have to experience them, no matter your age. No one should have to go through that. And as much as they affect everybody differently, and everybody handles them differently, sadly doctors don't really accept that. I went through physical and emotional abuse in my early teens at the hands of my father, and luckily I've come out the other side of that as a very, very positive and very strong person, and I was extremely lucky to have the support of friends and family, which got me through it, and I had years and years of counselling, and I've buried that hatchet. It doesn't bother me particularly. I can talk about it very openly, and I have nothing to do with my father. Unfortunately, doctors don't understand this. The only doctor who does is my neurologist, who, as I've said countless times, is a fantastic doctor and listens. And listen is the key word here. My GP, on the other hand, doesn't quite understand this. We're having a little argument over this at the minute. And unfortunately, for people who have a history of trauma, they tend to pounce on this and say, you don't have dystonia then, it's because you have this history of trauma, and because of this your body is, your brain is processing this in a way that it's interpreting this in a physical form to help deal with this, because it can't handle what you went through. So it's coming out in this physical form of spasms. So you don't actually have dystonia. You just have this psychosomatic issue, which some people might. Fair enough. I don't believe in it. I think it's a load of rubbish. Because otherwise, they would get better. But my neurologist, I was very, very open with him about everything. I believe if you're going to get treated, you should be open with your doctors. So I was very, very open. I told him everything. And because I have pain-triggered non-epileptic seizures, I asked for cognitive behavioural therapy to help me deal with them. And again, with her, I was very, very open, very honest. And both of them have written to my general practitioner saying Rebecca's history of abuse has nothing to do with her dystonia. Absolutely nothing. Sadly, I don't think he's actually bothered to read these letters, and if he has, he's forgotten. I think I need to start printing them off and highlighting them and bringing them with me and waving them about and going, read them! And sadly, in this world, a lot of people experience abuse. I'd like to meet, I think if you line 10 people up, some of them, probably 5 of them at least, would have some sort of abuse, physical, emotional or sexual. Because this is a very sad world, unfortunately. Everyone at some age goes through something. It's just what we live in. But we don't all develop an issue. If that was the case, we'd all be ill, and we're not. So he can't. Oh, so I could go on about it for ages. It makes me quite angry. But yes. So it's my little rant, really. And it's a shame, but my advice for people like me, who every now and then the doctors decide that they're not going to listen to the neurologists who are saying, no, it is dystonia, we're going to treat with this and this and this and this. So, you know, when they decide to ignore that, do what I'm doing and go along with them. Hold your hands up and go, okay, I will jump through your hoops. I will go and see whatever psychotherapist you want me to. I will, you know, write in their journals. I will talk for the couple of hours they want me to. I will open my soul. Do it. And do it open. Don't do it sarcastically. Do it honestly. And you know, it might even benefit. You know, you might get a load off your chest. You never know. Because living with dystonia is hard. It does make you feel like crap. But, you know, you do have those down days. But it proves to the doctors that they are wrong. And the neurologists are right. But yeah, that's my little rant. An odd way of promoting Dystonia Awareness Week, ranting, but it gets it out there. Tomorrow's one will be the topic that I was meant to do today, which was therapies. Sorry, had to get it out there. But yeah, so I'll see you then. A blog will be going up later today, I promise. So check out Dystonia and me. So see you soon.